So we have an 84 years old woman with a lower esophageal neoplasic stricture. The purpose today to go to see the stricture and take maybe some biopsy and put a stent. So this is our upper esophagus. We see a lot of food here, so I will try to clean it before doing anything. So this is our beginning of the tumor here. I will advance my scope and try to guess with my lumen. So I will wash a little bit. I don't want to hurt the mucosa to avoid bleeding. I don't see the lumen here. So what we will do, maybe from here. So we will go to fluoroscopic view. اهبط لوطة شوية اهبطها. زيد اهبط زيد. اقعد هكاكا. يجيني لنا شوية ترى. سي بون هكاكا ترى. So we have to found our direction. So I will suck all the water before. And we have two options here. Try with the guide wire. So that's what I don't like, the bleeding. Or put some contrast. So we will go to the distal part here. I will put some contrast and try to see where is our direction to follow. So on continuous fluoroscopy, and we see. So I don't see any passage here. Stop, c'est bon. أعطيني في الجيدة. So we will go with our guide wire. البالون تاعك منفوخ بالكدا غادي. نشيحو شوية. So I will try to guess the direction. I don't see anything with this bleeding. امشي طاب شوية. امشي. أرجع. امشي. أرجع. امشي. أرجع. امشي. 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 اقعد هكاكا. خبي في الجيزة. امشي. خبي. امشي. امشي سي بون. So we crossed the cardia here. So now the stop. So the first thing to be sure that we are in the good direction, we have to see we have to see the big loop. This a big loop in the stomach. So we see here clearly it's we have a big loop here. So now I will put some contrast. Injecter. Donc ça لازم نلقاو رواحنا البوك الكبيرة. Comme ça on n'est pas dans une fistule. So we'll put some contrast and we see the shape of the stomach here. So I want to see my distal stomach. I will go with my sphincter tab. And this is the shape of the stomach here. Maybe I am in the antrum here. So this is the stomach. We see it clearly. So we are not in a fistula. And now the next step will be to see the lower part of the cardia. I contrast. Injector. And this is here my stricture. So I think we will put the stent from this marker to this marker. So we will need, this is 5 centimeter stricture. And I have just to see the upper level. And we see the tumor beginning here. So my stent have to be released at least here. هاي قطع لي بسكوبي الفوق شويه ترى زيد شويه سي بون هكاك اعطيني ماركور هاي نحي كل واحده نتاعهم. So this is my first marker. I will follow here. So we should place it here. هاي حط لي هنا. So I have to release my oral part at this level. And now the lower part. So I will go with my and the distal part will be here, at least here. So if this will give this, so I will merge. So we will need the 10, 12, 12 centimeter. So we have 12, at least 10 centimeter, and we will use 12 centimeters. عندنا 12 partiellement couvert. Très très bien. So the next step will be exchange. We will take out the cannula. حط الماركور ثاني ما حشناش بيه ثاني. حطه هنا. So we exchange now the wire. We leave the wire there. And something important we don't have to forget is the biopsy. Even if she's 84 years old, we have to get the proof of malignancy here. هاي بانس بيوبسي واعطيني بروتيز اش عندنا بارسيال متاع شكون اعطيني ميكروتيك بانس وريني ترى سانت 24 12 parfait très très bien هاي. So we will take our biopsy now. ماناش نجم شدي نقول لك اللي ما يعديش باهي مش مشكله يا با سوسي توت فاسون لا احنا باش لا شد يحط البانس غادي يحط باش نعملوا بيوبسي نتاعنا احنا توت فاسون in all case the biopsy for sepsis is 2 mm. We have a guide wire in the gastroscope. It's not a therapeutic one, so I will now go out with the scope. In all case I will put my in all case I will release my stent under endoscopic and fluoroscopic control. هذه اللي شده حطيها سيب له سيب هذه شد عندك انت، عطي هذه عطي شد عن بيوبسي انت. So I will go now with my gastroscope to take my biopsy. So the wire is in place. هاتها. حضر دو كليب باش نعمل فيكساسيون بعدها. حلها سكرها حلها سكرها. So I will take maybe 4 biopsy. We see a lot of bleeding, but it will be compressed by the stent. حلها سكرها. I think it's enough for me. شدي عطينا البروتيزة. So we'll clean out. طيب هذه ديما نقول لكم ركحوها بالكدا، علاش هكا بربي، علاش شكون حط هذيك؟ So I will clean my view. I will clean the blood now. I will leave the scope inside and we'll use a 12 centimeter partially covered stent. مشي في الكده. شد اللي انت غادي هذي ليا. عدي يمين عدي يمين عدي غير بتحل عدي يمين صح. شد. So that stent is a Microtech 1. تعطيني الامبلاج نتاعو. مشي عاد. هاته امشي 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 امشي. اطلق يا ناهد اطلق. امشي 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 امشي. Stop. So we will move some gel here to facilitate the progression. My scope in place. So just get عليك سيب شد في الكلام شد. So what we have to do, I will just save the saber and I will try to go while pushing. I will see my fluoroscopy and I have the loop there. So we have two choices: try to push it and the gastroscopy in place, and if I have some resistance, شد لي هاك شد. Some resistance, I will take out my tube. هذه اللي شد البروتيز شد. ديما شد التوب يرد بالك. So now it should be easy to cross. So we see it coming and we see on the fluoroscopic view the wire is looping there, so I will just put it in good direction and my stent is coming. We have to cross here, so we have to cross gently and we are crossing the stricture here, and I think we cross the stricture, so it's okay. So now I have to see my upper marker, so I will go further there and I see the upper part of my stent, so I will pull it back a little bit and if we release here it will be okay. Parfait, très bien. Tac tac tac, tiny fibroscope. So we have two choices. We can release it only with fluoroscopic view. I'm not sure that I will be able to have the endoscopic view, I have to cross the upper esophagus sphincter, which with just one stent there, not always easy. So we try to follow our stent, and if I won't be able, I will just release. I'm going slowly here. It's a little bit tight, and we are in the upper esophagus. So this is my stent, and this is the upper region. اطلع لي فوق شوية ترى. So we are good here. I will just wash a little bit. I want to see my stent at the end of the releasing. So this is where we have to be. So we have to cover this part. So it should be okay. I should لي هكذا. هكذا. طيب. So we open the system. So this is open. أعطي اللوطة شوية. So we have to look at the lower part because the releasing with a distal releasing beginning, and I will push, and in the same time, you see in the endoscopic view the stent advancing, and you see that the lower part is going far away on my repair. So I will pull it back, and I will push, and you see where it's going. It's too far. I don't need it so much there. So here it will be okay. And I need really to cover the upper esophagus. So until now it's okay. So at this part I can now just release and pull back. And the difference of the two just now we are doing, I'm not moving my right hand, but I'm using my left one to open the stent. And you see in the endoscopic view, I see clearly the lower part of the tumor. I will pull back slowly. I need to see I need to see the upper part. اطلع لي بسكوبي لفوق شوية توا. اطلع. C'est bon كيكا. So the stent is really low now. I have to pull it back in the upper esophagus like this. Everything is covered in the lower part. اطلع فوق شوية ترى. Hop. Voilà. So here I'm okay. I can pull it a little bit. لا سي بون. قاعد على سكوبي قاعد نعس. نحب نخرج. طبعا بسكوبي لوطة شوية ترى. لقيت مازلت على هبطت برشا الماء. هكا سي بون. طلعوا شوية. اطلع لفوق شوية ترى. Très bien. And we are releasing slowly. And it's okay. Perfect. So the stent is fully opened now. We have covered everything. شد هكاك عندك انت. So what we have to do now is just to take out our system from here. شوية. C'est bon. So we covered everything here, and the most important thing was the upper part. So we won't try to cross, of course. We will clean here everything. اعطيني contrast. So never try to cross a new released stand. You can dislodge it. حضر لي الكليب سيزا. اطلع لي سكوبي لفوق شوية ترى. So I will inside the stand and see my اهبط لوطة شوية ترى. And we'll see how we have the contrast. If everything is okay, going okay. C'est bon, parfait. So we have to fix now our stand. هاي اعطينا سيزا. خلي. I have to get the best place to anchor this stand. نبدأ سكر ترى. سكر ورا. So we maybe put 2 or 3 stands. هات واحدة أخرى. هلا. رجعوا هكي مكانته. تعرف ما نجمش نخدم هكا بعد طولتك ما عادش عشك بيها انت راهو. بدأ سكر ترى. سكر ورا. استنى شوي استنى شوي. نشدو جيست وحدة. بدأ سكر ترى. سي بون. هات واحدة أخرى. So I will put the last clip. هلا. سكر سكر. هلا. بدأ سكر ترى. سكر ورا. نزي هكا ها. إذا عندك كونتراست. هاتا. أبدأ فايقة. طلع لي طاولة ولا هبتوسكوبي خلينا ناخذ تصويرة كاملة. سي بون اهبط لي لوطه شويه بسكوبيترا. سي بون يزيد. So we'll see our contrast coming now. And you see everything is okay. Perfect. C'est parfait. Hein? ليه jamais هبش نقول لك علاش. So the question, can we cross this stricture? But what you will see, it look easy to cross, but look at the where we are, and here we can cross it, but we will have probably migration of the stand. كي باش نتعداو باش نحركوه. Il peut migrer فهمتني في الدخول ولا في الخروج. So never try to cross the new stand. If you want to explore the stomach, come back after 2 days. It will be fully opened and you can cross.